It's a huge undertaking. Maine is currently building a new system for children and adults with developmental and physical disabilities.
The lifespan waiver would provide more comprehensive services at age 14 to help those people transition into adulthood. The program is expected to clear years-long wait lists and provide more opportunities to live independently. However, some families fear a new system will eventually cause much-needed services like group homes to disappear.
News Center Maine's Vivian Lee has our update from Augusta.
Her housemates are her friends. They've been her friends since high school.
Debbie Dion's daughter Kate lives in a group home in Brunswick.
I miss you. How have you been?
She has cerebral palsy and an intellectual disability following a traumatic birth 43 years ago. Staff help her live independently, something that would be difficult for Debbie and her husband to do for their daughter. Another worry, 75 group homes have closed their doors in Maine amid low Medicaid reimbursement rates.
If she were to lose this housing, I'm 71, and aging. Our home is not accessible. I do worry.
Parents have been raising a number of concerns since the Department of Health and Human Services announced a new plan last spring, revamping the state's system of services for children and adults with intellectual and developmental disabilities.
Good.
Families of special needs children must apply for different waivers for home and community services, primarily paid by federal Medicaid dollars based on their needs. The lifespan waiver would enroll children as young as 14, eliminating waivers and wait lists across their lifespan.
Our goal really around lifespan is that a person can stay in one waiver, not have to switch, and then get the services that they need as they age.
Hopkins says under lifespan, people can continue to live in group homes and receive services.
When lifespan,
DHHS officials who have been collecting comments from the public over the summer are currently holding listening sessions with parents and providers. Lucinda Turcott is an adult case manager with Brighter Heights, Maine, which provides a number of services, including case management for special needs children and adults. She says severe shortages of skilled staff to work with this vulnerable population are still a big concern, as is funding.
We're being told we're developing another waiver that's not going to have wait lists, and I'm not confident that that's a guarantee because, as we all know, the funds are, have to go through the legislature.
Now, a rate study is underway, and that could result in better pay for direct support workers and agencies. Now, the lifespan proposal still needs federal approval and has to undergo the legislature's rulemaking process next spring. If passed, enrollment could begin in January of 2025. In Augusta, Vivian Lee, News Center, Maine.
Information sessions on the lifespan waiver will be held in Caribou, Bangor, Lewiston, and South Portland all next week. There are also virtual sessions on Zoom. We'll have much more information on our website and News Center Maine app.